at Litsembalet Women's Clinic in Matapa, where most of the male circumcision takes place. We are here to see Dr. Gladys Magongo, who has the highest number of circumcisions. Let's go and check it out. We are with Dr. Gladys Magongo, a male circumcision doctor. Tell us, Dr. Magongo, a brief background about Litsembalet Women's Clinic.
Thank you so much, Wandile, for this opportunity. Litsembalet Women's Clinic, it was opened in 2009 in June. The main purpose of this clinic, knowing that Swaziland is one of the countries that is leading in HIV and AIDS. So the main purpose of this clinic, it was to sort of combat or decrease the rate of HIV and AIDS in Swaziland by doing male circumcision. Studies have been done in Kenya and also in Tanzania, which has shown that male circumcision do prevent HIV and AIDS transmission by 60%. So basically, we've got different of services that we provide at the clinic besides male circumcision, which also include HTC. Basically, it's VCT, where we do testing. Before we do test our clients, we also do counseling on HIV. We also provide reproductive health education on our clients. And one of the services that we also provide here is a STI treatment. Basically, we treat all STIs at the clinic. We're at the reception now. Basically, this is where our clients will arrive when they've come for the different services that we provide here at the clinic. What happens at the reception, we've got our receptionist here. They will open the file for the clients. And after they've opened a file for the clients, then there will be a group discussion that usually happens here. In the group discussions, what really happens, they talk about the benefits of male circumcision, how is it done, the procedure, and we also encourage their partners to be with them during the group session, and also if it's a minor, that is a client that is below 18 years, the partner or the guardian, they will also be part of the group counseling session. Then after the group counseling session, the client will be taken by one of our counselors, basically to another side. I'll be showing you shortly. In the individual counseling sessions, basically that is one-on-one now, talking about the male circumcision and also talking about HIV and AIDS. Once the group counseling has been done at reception, as I've shown you earlier, the counselors will come and take the client and the file into one of these counseling rooms. Basically, we've got 3 counseling rooms. So let me just show you inside how it looks inside the counseling room. So this is where the counselor will sit, and also the client, that's where they will sit. Here there's a repetition of what happens during the group counseling. They talk about, again, the benefits of male circumcision, explaining why is it important to do a male circumcision, and also how is the procedure going to be done in theater. And also they also do the HIV testing and counseling here. We've got some charts on the walls. Basically, they also help for the counselor to follow the protocols of the clinic when they're doing the testing. They also encourage the clients to ask questions that they might be scared to ask when it was during the group counseling. Once they are done with the individual counseling by the counselors, then the clients will come into this room. Basically, here we have a nurse who is stationed here all the time. The nurse will need to do a physical examination on the client to see if there are any contraindications for the procedure. We've got this couch, that's where the client will lie, and the physical examination will also be done. What also happens here, they also check the blood pressure, because it is very important to know the blood pressure of the client before they go inside theater.
We're in one of the operating cubicles. This is where circumcision takes place. Take us through, doctor.
Thank you. Okay, basically what happens here, the client will come inside, brought in by a nurse. Then, because they are wearing their street attire, we'll ask them to undress basically the lower garments. Then we give them that gown, which they put it on. And then we ask them to lie on the bed. And then the nurse will open this tray. This is the kits that we used when we were doing the procedure. The nurse will clean the client, and then they will also give an injection just around the base of the penis. We say it's a ring block, dorsal penile nerve ring block. And then when the injection has worked, we also test it using a certain instrument to see if the client still feels pain. When the client does not feel pain anymore, then I will come and do the cutting of the foreskin. Then, after I've removed the foreskin, I will use this machine. It's called the diathermy. This machine basically it cauterizes, or it stops the bleeding, the bleeders. Then after I'm done with this machine, then I'll only put 2 sutures, and then I'll move on to the next client. Then another nurse will come and finish up the suturing. Basically, we also have a red liner. That is where the waste with blood is put on. It's called the infectious waste. And then we have that yellow bucket there. That's where we put all our sharps. In all the rooms, the sharp containers is available. And then we have that purple bucket. Basically, there is a decontaminating liquid, so that after the instrument have been stained with blood, we then put them there for about 10 minutes. Basically, we are sort of decontaminating them so that then they'll be taken out for cleaning and then disposed. After we are done with that, the client will then be dressed again and then will be taken to another room. I'll show you later. It's called the recovery room.
Now we're in the last phase of the circumcision process, the recovery area. Tell us, doctor, what happens within this area now?
Thank you, Wandile. Basically, what happens here, the client will come from theater. He's going to be received by a nurse who is always stationed here. Then they will be asked just to sit in one of these chairs. We want them to stay with us for at least 30 minutes after the procedure. The reason being that we want to observe them. Is there any bleeding? If they are reacting to the injection that we have given. And then once we are satisfied that everything is fine, the nurse will check also the blood pressure before they are discharged home. Again here, while they are still sitting, we give them some pamphlets to read, mainly on circumcision and other benefits, which are on this small table. And then again here, the nurse will give them some painkillers that they usually take before they go home. And then they take some more supplies with them home. And we've got the nurse here also captures the data in the computer and also in the register.
Thank you, doctor, for your time, and we hope more male Swazis will come for circumcision. Thank you. Thank you for joining us in our tour at Litubalet Women's Clinic, a male circumcision clinic in Swaziland.